Cancer is one of the public health problems that has continued to gain global attention. It is a leading cause of death worldwide. Several risk factors are responsible for this deadly disease. According to research, there are clear evidences that establish radiation as the cause of most common forms of cancer. One may wonder, where do these radiation come from?
We are really talking about ionizing radiation and also the radiation we get from sunlight. Okay, so from sunlight, we're talking about ultraviolet rays, which is being implicated in cancer, particularly the skin cancer called melanoma and other non-melanoma skin cancers. All right, and for the ionizing radiations, we get that from X-rays, and we can get that from CT scans or to mammogram, especially when it comes to screening for breast cancer. So repeated exposure has been implicated in the incidence of some breast cancers.
It has been speculated that telecom mast also emits some radiation which could be harmful to humans. For instance, Lagos State, the commercial nerve center, houses a good number of telecom companies. This explains the presence of masts in every nook and cranny of the city. Some of these masts are seen in residential areas beside buildings, plus the citizens receive good compensation for the erection of masts within their locality. However, medical practitioners have debunked the assertion that the radiation from telecom masts may lead to cancer.
When we are talking in medicine, we have to be evidence-based. We have to do research, we have to correlate and be able to say from so year to so year we've done this and this is what happens. Now for telecom masts, what they deal with are radio waves. Radio waves is also what we use on our phones. Okay, is what the TV network use, like NTN, everybody's radio waves, and they are non-ionizing radiations. That means is that they cannot disturb the cell, the atom of the cell, and cause to knock off electron. They've not been shown to cause damage in the DNA of the cells. And so if you can't cause damage in DNA of the cell, according to science and pathology, they can cause cancer. Okay, so until we are able to link that, number of people that have, masts in their compounds, follow them for 5 years or for 10 years, they develop a particular cancer, and people that don't have masts don't have that kind of cancers. We can't generalize that. It's just speculation.
With over 200 types of cancer, which can occur in different tissue or organs of the body, symptoms may vary widely.
It depends on what part of the body that the cancer is affecting. It is not a general thing, but the things that people may notice generally is probably reduction in weight, that is weight loss, maybe loss of appetite, and a patient may appear cachectic, like looking lean, thin, and all that.
Medical practitioners have continued to emphasize on the need to present a cancer case early, as there are various treatment options.
The treatment options of cancer, you talk about surgery, you talk about use of drugs that are called chemotherapy, you can talk about use of radiation therapy that we also alluded to, is also used to treat. And though we have said earlier that radiation can also be a cause of cancer, but it's also useful, it's used to treat. And we also know that there are other forms of treatment what we call targeted therapy, the molecular level, hormonal therapy, and several like that.
It is pertinent to note that cancer is not a communicable disease, but early detection is key to recovery.